Nurturing Generations, Lactation Support in Multi-Generational Families. This is video 3 of the Strong Village, Strong Start series, a family-focused lactation support guide. Welcome to Nurturing Generations, Lactation Support in Multi-Generational Families. Congratulations on taking this first step to support your family during this hectic time after the birth of a new baby. Your support is so important to your loved ones. Let's dive right in. As we all know, families look different. There are vast combinations and connections of cultures, personalities, and belief systems that make up the families we know and love. We are here to support you all. So let's start off with, what is a multi-generational family? A multi-generational family refers to family structure where multiple generations have close, interconnected relationships. This can include grandparents, parents, children, and sometimes even great-grandparents and aunts and uncles, all maintaining frequent interactions and support systems. Intergenerational families often share responsibilities such as caregiving and emotional bonding across generations, contributing to a stronger family unit. These families can foster cultural, educational, and life experience exchanges between generations, benefiting from the wisdom of elders and the energy and perspectives of younger members. FYI, this includes fathers and grandfathers. They may not have direct breastfeeding experience but can contribute by encouraging their partners or helping manage family expectations around feeding. They can be instrumental in building a breastfeeding-friendly household environment. Since you are listening to this video, we are assuming you are a part of a multi-generational family who has just had a baby. Congratulations! This can be one of the most rewarding times in your life. Now let's get you ready to support. Family members can play a crucial role as advocates for breastfeeding, especially in public or social settings where younger parents may face scrutiny or discomfort. Your visible support can challenge societal stigmas or family pressures that might discourage breastfeeding. In many cultures, intergenerational support extends beyond immediate family, involving community elders and neighbors, who play a key role in creating a breastfeeding-friendly atmosphere. Older women in the community might gather to offer guidance, creating a larger network of support that goes beyond just one family. While older generations bring valuable experience, sometimes their knowledge may be outdated, especially if modern breastfeeding practices have evolved. Balancing respect for traditional wisdom with contemporary lactation science is key. Open communication and mutual learning across generations can help blend the best of both worlds. Bringing a new child into the world comes with many decisions. This can be overwhelming for some people. As a grandparent, you will want to help the new parents talk through some of these things and support their decisions in rooms with other people. What is advocacy? Advocacy for a breastfeeding person involves supporting and promoting the rights, needs, and well-being of individuals who are breastfeeding. This type of advocacy seeks to create an environment where breastfeeding is encouraged, supported, and protected by addressing barriers and raising awareness. Elders, such as grandmothers or older relatives, often share their personal breastfeeding experiences and tips with new parents. They may offer advice on latching, milk supply, or overcoming common challenges based on their own parenting journey. This process is invaluable in creating a nurturing family bond, making new parents feel supported, and developing a sense of continuity and trust in breastfeeding practices. Sharing your infant feeding experience is important, but be sure to respect the feeding choices of the parents, even if they do not align with your own. There are various ways to feed a baby, and as long as the baby's nutritional needs are being met, all of them are valid. Let's talk about a few ways so you can be familiar with them. The first and most traditional is feeding directly from the chest. I am sure we have all seen this. Most call it breastfeeding. And so that we are all clear, it is legal to breastfeed anywhere you are legally allowed to be. Be sure to support the lactating parent by creating safe spaces for them to feed your newest family member. Another way to feed a baby is pumping breast milk and bottle feeding. For some, getting the baby to latch properly is hard. Even with the help of lactation consultants, some parents choose to pump and bottle feed, and that is totally okay. A third example is a combination of both. Some parents choose to feed directly from the chest and pump and bottle feed. This is a great option as well, since others can assist in feedings. One more example is supplementing with formula. This is where a family chooses to feed both breast milk and formula. There are many reasons a family might do this, including perceived low milk supply or maybe returning to work. Regardless of the reason, this way is okay too. Some families may choose to use all of these feeding options. My point here is to be respectful of the new parent's choices. Everyone's experience is unique, and that requires flexibility and support. In some families, older generations may not have breastfed because formula feeding became increasingly popular throughout the 20th century. During that time, societal trends, advancements in formula production, and marketing campaigns led many parents to choose formula over breastfeeding, which was often seen as a more modern or convenient option. This shift was also influenced by medical advice of the era, which sometimes promoted formula as a healthier alternative. As a result, breastfeeding rates declined, and the practice was less common in some families, impacting generational breastfeeding knowledge and support. Today, many families are rediscovering the benefits of breastfeeding while balancing it with the understanding that infant feeding practices evolve over time, based on personal circumstances, access to information, and cultural norms. In these cases, younger parents may be reintroducing breastfeeding knowledge into their community and normalizing the practice. This can create a new learning dynamic where older generations become supportive allies in learning modern breastfeeding techniques, perhaps through classes or workshops. Additionally, over time, with advancements in science, we learn that certain practices may need to change. One example of this is safe sleep. Modern guidance focuses heavily on creating a safe sleep environment to prevent SIDS and other sleep-related dangers. Check the resources at the end for a resource on safe sleep. Intergenerational breastfeeding support can help preserve cultural traditions and breastfeeding rituals specific to certain communities. Many communities have rich traditions around childbirth and infant care, including breastfeeding. It's important to recognize and respect these cultural practices, which may involve specific rituals, foods, or beliefs related to breastfeeding. Be supportive of this even if you do not share the same beliefs. It's important to consider cultural, historical, and systemic factors that may influence some cultures' breastfeeding practices and experiences. The term BIPOC stands for Black, Indigenous, and People of Color. This term is used to highlight the unique experiences and systemic inequalities faced by people of color, with particular attention to Black and Indigenous communities due to their histories of oppression and marginalization. In some communities, particularly among Black and Indigenous people, the legacy of slavery, colonization, and systemic racism has created mistrust of the healthcare system. For example, during slavery in the United States, Black women were often forced to serve as wet nurses for white families, which disrupted breastfeeding for their own children. These historical traumas can still affect perceptions of breastfeeding today, and it's essential to acknowledge these legacies when providing support. It is important to take this power back and continue to build a strong, healthy community through breastfeeding. You can help in this area by encouraging your loved one to begin or continue to breastfeed. You can learn about the benefits of breastfeeding for both baby and parent in Video 1. The Power of Milk: Why Human Milk Matters for Health. Some communities often face unequal access to healthcare services, including lactation support. These disparities can contribute to lower breastfeeding rates, especially when access to lactation consultants, culturally competent healthcare providers, and breastfeeding education is limited. Addressing these inequities involves creating more inclusive and accessible healthcare systems, and for you, advocating for your loved one in finding support. Look for the Finding Support link in the resource slide. Many families are more likely to face economic challenges that can impact breastfeeding, such as the need to return to work quickly, limited access to paid maternity leave, or lack of workplace accommodations for breastfeeding or pumping. Help support your loved one by helping them apply for programs such as WIC or SNAP and sharing resources such as the Making It Work Toolkit. that can be found on the resource slide. Many families may not see themselves reflected in mainstream breastfeeding promotion materials, which can contribute to feelings of exclusion. Some communities face stereotypes that may undermine breastfeeding efforts. For instance, Black women in the U.S. may encounter societal myths that they don't or won't breastfeed, despite evidence to the contrary. Educating healthcare providers to avoid biases and assumptions while empowering the parents to make informed choices about breastfeeding is key. Please help to normalize breastfeeding in all communities. Breast milk is our most natural and nutritious first food. There is a correlation between low breastfeeding rates in BIPOC communities and higher rates of chronic diseases such as obesity, diabetes, and heart disease. Breastfeeding has protective health benefits, including reducing the risk of these conditions for both mother and child. Give your newest family member the best possible start in life by actively supporting breastfeeding, by encouraging and assisting new parents in their breastfeeding journey. You can help create a nurturing environment that fosters strong bonding and contributes to the baby's overall well-being. Your support can make a significant difference, whether it's providing practical help, offering emotional encouragement, or advocating for breastfeeding-friendly spaces. You can ensure that the baby has the opportunity to thrive. New parents are recovering from childbirth while learning to care for their baby, which is a process that can be both joyful and challenging. Support their emotional needs by allowing space for all emotions, whether positive, negative, or complex. Try to listen actively. Use your active listening skills and observe the environment to understand how to best support them. Help them, don't just visit. Make your presence truly supportive by pitching in. Here are some ways you can help. Assist with baby care, such as preparing for feedings or changing diapers. Keep the lactating parent hydrated and provide easy-to-eat snacks. Offer entertainment options like books, TV, or music to help them relax. Wash bottles and pump parts to lighten their load. Take on household chores such as laundry, cooking, cleaning, or yard work. Give them a break by taking the baby for a walk or holding the baby while they rest. Offer reassurance and speak positively about their breastfeeding journey. While these suggestions offer valuable ways to support new parents, it's essential to communicate openly and ask them directly what they need and want. Every family is unique, and their preferences and priorities may differ. Additionally, as a support person, you will want to know the difference between the baby blues and perinatal mood and anxiety disorders. Let's dive into that subject a bit more. It is important to know that a birthing parent has been through a lot of changes, physically, hormonally, and emotionally. Some moodiness and emotions are a normal part of having a baby. However, as a support member, it is important to be able to recognize when someone might need help. About 60 to 80% of birthing people may experience baby blues. These emotions are normal as hormones change, and usually occur within the first 2 weeks following birth. The birthing person may be tearful, feel overwhelmed, experience fatigue, and more. This experience is usually mild and should resolve on its own within a couple of weeks. 1 in 7 parents will experience a perinatal mood and anxiety disorder, PMAD, after birth. The following are signs of depression: lack of interest, helplessness, loss of joy, isolation, irritability, feelings of guilt or shame, or even crying often. Anxiety could be racing thoughts, restlessness, scary thoughts about the baby or their safety, or feelings of dread, and some with PMAD experience anger or rage. Perinatal mood and anxiety disorders, PMAD, can be more severe than the baby blues and may require the care of a mental health professional. Talk to your doctor if you suspect this. You can also call the North Carolina Mental Health Hotline at 866-903-3787 or dial 988 for immediate services. It is important to remember that it may take up to 3 to 5 days for the new nursing parent's milk to come in. They will need to do frequent feedings during this time to stimulate milk production. Remember that the baby's stomach is very small at this point, so small, frequent feedings are ideal. It is expected for newborns to lose up to 10% of their birth weight. But there may be some discussion around supplementation, if there is more weight loss than that. Supplementation is in addition to breastfeeding, not a replacement for a feeding. Always breastfeed first and then supplement. Replacing feedings with formula or donor milk could cause an even lower milk supply. To return to birth weight, infants often cluster feed. This is why it is so important to look for hunger cues, like rooting, lip smacking, mouth movements, and/or sucking on the hands or fingers. Let the baby guide the feedings, not the clock. However, sometimes you might have to wake the baby to feed if it has been more than 3 hours. The baby is expected to regain their birth weight within approximately 2 weeks after delivery. Each baby is unique, and how much and how often they feed will depend on their individual needs. Pay attention to hunger cues and feed when you see the signs. Here are a few examples of hunger cues. Rooting. The baby turns their head with an open mouth, looking for the breast or bottle. Sucking on hands, fingers, or clothing. Smacking or licking lips. Opening and closing their mouth. This repetitive motion is often a way of signaling readiness to feed. Turning head toward the breast or bottle, known as the rooting reflex. Babies naturally turn toward potential sources of food. Soft whimpering or cooing. Low-level noises can be an early indicator of hunger before crying begins. Increased alertness or activity. Babies may seem more awake and engaged as they look for food. Moving hands toward their mouth. Reaching movements towards the mouth area can signal hunger. Clenching fists and bringing them to the mouth. Fisted hands, especially near the face, are often a hunger cue. Crying is a late-stage hunger cue. Try to feed the baby before they begin to cry. You can help with this by recognizing the feeding cues early and preparing the baby to feed. Let's discuss bottle feeding, which may be necessary at times. Here are some key points to keep in mind. Never microwave formula or breast milk, as it can create hot spots that might burn the baby. Breast milk doesn't need to be warmed. It can be served cold or at room temperature. Formula bottles should be used within 30 minutes of preparation or refrigerated for up to 24 hours. For families using both breast milk and formula, start feedings with breast milk first and offer formula as a supplement if needed. There may be times when you can help with feedings. Always ask the parent if they'd like to do the feeding themselves or if they'd like assistance from you. Helping to wash bottles and pump parts is a simple yet meaningful way to support new parents. Being attentive to these details ensures that feedings are safe, efficient, and supportive for the family. Here are some intake guidelines for bottle-fed babies. A newborn baby's belly is tiny. He or she does not need a lot at each feeding to be full. In the first days, feeding should be around 30 to 60 milliliters or 1 to 2 ounces per feeding. Most infant newborns will feed 8 to 12 times in 24 hours. In the first weeks and months, feeding should be around 60 to 90 milliliters or 2 to 3 ounces per feeding. You may need to wake your baby to feed, since feeding should be every 3 to 4 hours, even throughout the night. At 6 to 12 months, feedings are around 90 to 150 milliliters or 3 to 5 ounces per feeding, feeding 5 to 6 times in 24 hours. Babies will generally take what they need at each feeding and stop eating when they are full. Let the baby lead when bottle feeding. See the resource about paced bottle feeding at the end of the video. Please note, do not put cereal or other food in a bottle. Putting infant cereal or other solid foods in a baby's bottle will not make them sleep longer and could increase the baby's risk of choking. Breastfeeding is recommended by the American Academy of Pediatrics, the AAP, up to 2 years of age, with exclusive breastfeeding for the first 6 months, followed by continued breastfeeding alongside complementary foods as desired by the parent and child. Here are some guidelines for human milk storage. Freshly expressed or pumped milk can stay at room temperature for up to 4 hours, in the refrigerator for up to 4 days, and in the freezer for 6 to 12 months. Thawed previously frozen milk can stay at room temperature for 1 to 2 hours, in the refrigerator for up to 24 hours, and cannot go back into the freezer once thawed. If there is milk that is left over from a feeding that the baby did not finish, You will need to use that within 2 hours of that feeding. After 2 hours, discard the contents. Here are some common beliefs about spoiling babies and why those beliefs are often misconceptions. Myth 1 is holding a baby too much will spoil them. The reality is, babies thrive on physical closeness and emotional security. Holding a baby helps build trust and attachment, which are crucial for healthy development. Myth 2 is responding to a baby's cries will make them dependent. The reality is, when caregivers respond promptly to a baby's cries, it teaches them that they are safe and their needs will be met. This fosters independence in the long run as they learn to trust their caregivers. Myth 3 is that too many toys or gifts will spoil the baby. The reality is, babies learn through exploration and interaction with their environment. Providing toys and opportunities for play supports their cognitive and motor development as long as the toys are age-appropriate. Myth 4 is breastfeeding, or bottle feeding on demand, creates bad habits. The reality is, feeding on demand helps babies learn to regulate their hunger and fullness cues, supporting healthy eating patterns as they grow. Myth 5 is letting a baby sleep with you will spoil them. The reality is, while co-sleeping may not be safe for everyone, sharing a sleep space can provide comfort and security. It's essential to follow safe sleep guidelines if co-sleeping. Myth 6 is allowing a baby to be carried around all the time will make them clingy. The reality is, being carried helps babies feel secure and loved. As they grow and develop their skills, they naturally become more independent. Myth 7 is giving in to a baby's demands will teach them to be manipulative. The reality is, babies don't have the cognitive ability to manipulate. They express needs and emotions. Meeting those needs helps them develop emotional regulation and social skills. Myth 8 is that too much affection will lead to behavioral issues. The reality is, consistent affection and nurturing create a secure environment that reduces the likelihood of behavioral issues. Children who feel loved are more likely to display positive behavior. Overall, meeting a baby's needs, whether through physical affection, responsive care, or engaging play, is essential for their emotional and developmental growth, rather than a path to spoiling them. Thank you for watching Nurturing Generations. A family that supports breastfeeding creates healthier and stronger connections across generations. Together, we can make this journey rewarding, supportive, and filled with love. Here are some valuable resources to support breastfeeding within your family. Be sure to check out and share www.breastfeeding.com.